approaches that you've seen?
Great question. So I've worked with multiple different continents now, and I'm very, very privileged to have that opportunity. I see that we are more aligned and all dealing with similar issues than we are different, which is heartening to me to know that, okay, we're all in this together, literally. And I would say that mobile capability is so key when it comes to the space of public health and health, because you're trying to be able to get to very remote places. So let's take California. California is a very populous state, right? We have 40 million people in our state. However, most of those populations are really concentrated within certain regions. And we have some very rural areas where it might take 5 hours to drive to one healthcare facility and sometimes not be able to have access to this region through snowy mountains or different types of terrain at different times of the year. You take that same situation and you apply it to places in the Middle East, places in Europe, places even in Australia, right? All of these different locations in Africa, etc. They all have very rural, remote, hard to reach regions. And the only way that you can reach data collection is to be working with communities in these regions and really deploying mobile technology. The more that you can create mobile technology to be able to get you real-time data, the more you're able to work with this. I was in Uganda this last summer, and one of the things that I was really impressed with were researchers out there who had worked with different villages. And with each one of these villages that are super remote, we're talking in the middle of the border of the Democratic Republic of Congo, Rwanda, Uganda, right in these mountainous regions that have really no access to be able to get to healthcare easily. And this also happens to be what we call a hotspot area of the world, where it has all sorts of opportunity for a lot of different types of diseases to erupt because of the extreme biodiversity, where we have plenty of primate animals, everything from gorillas, chimpanzees, you name it, to livestock animals, to, kind of poor water conditions and people all intermixed in one area. And so because of that, they were able to have different leaders from these villages be able to volunteer. They received an iPhone and training on how to use an app. And that app had pictures of all the different types of like flora, fauna, like the different types of like environmental plants that they have, the different types of livestock and animals they have, different types of monkeys and different types of wildlife animals they had. And they could click on this to show whenever they saw some illnesses or deaths or problems within their environment. And it would sound an alarm to the local hospital where they had epidemiologists that could go out there and immediately be able to handle whatever it was, whether it was monkeypox or anthrax or a different type of, kind of malaria going through or whatever it was. And I just thought, wow, what a fascinating way to be able to work with the villages as trusted partners, even when there might be literacy issues, but a way to be able to use creative technology so that they could actually act and help these people as quickly as possible from different types of infectious diseases.
That's amazing. I feel like we often hear the conversation around the ills of mobile phones and mobile technologies, but we often may not speak to the innovation and the ability it gives us to really react to things in maybe more real time than we have had the opportunity to in the past. So I appreciate you sharing that positive example for us.
Yes, tech for good, I like to say.
Absolutely. So you've also led the development of California's healthcare pandemic mitigation plan. What were some of the most important lessons from that experience, especially in terms of data equity and coordination?
Yes, I have a great story about this too. So it's about a 50-page or something odd document that we created in February of 2020. And we realized that it was a Saturday morning when we realized we had a pandemic mitigation plan for the state of California when it came to the population, meaning the communities. But we had not had a pandemic mitigation plan for the healthcare system. And California had, 15,000 healthcare facilities, plus they were all in like 30 different types of, CMS recognized facility types. So there are different types of acuity levels, there are different sizes, their infrastructure is different, their access to supplies or contracting is different. And so we realized that we needed to be able to execute on, create a game plan for this. And so February 2020, it was interesting. I had actually just finished having knee surgery. And so my leg was actually in a long, like a whole body cast. And I couldn't even drive. My husband dropped me off with my crutches to the office on a Saturday morning. And I worked in my office with my leg up over the desk. And I just whipped out this 50-page document, draft document. And I think I finished around 3 or 4 in the morning the next day. And so, of course, I didn't wake up my husband. So I just got an Uber on the way home at like 4 a.m. from my public health state office with my crutches and my, the whole thing. And it was one of those telling moments I'll always remember, because the Uber driver was like, "Is it normal for public health people to be working in the office on a Saturday night until 4 a.m.?" And I'm like, "Nope, nope, it's not. It's not normal at all." So I was like, but it's about to become very normal. And that after that was just became the norm, where we were working 24/7. But the collaboration on that is, so I wrote the draft. And then, of course, that draft I shared with all of our 61 different local public health jurisdictions in California. I shared it with different leaders, stakeholders throughout the healthcare continuum, whether that was our hospital association or associations over different long-term care. And it became an iterative discussion of how do we be able to actually create a game plan as we go through this. And then through that, we issued several what we call all facility letters throughout that next year, constantly iterating on different advice, depending on what the situation was bringing or changing as we go.
Well, thank you for your commitment in doing so, and the story to tell about the work that you're doing. Because I think that that's very, very important, and also highlight sometimes just, you might have to go outside of the natural comfort zone to really do the work and to impact the communities that need that support. So appreciate you doing that.
Yes, and there's so many others out there that who did so much phenomenal work that I just was always blown away by how people kept showing up day in, day out.